Hello, we are talking about rheumatoid arthritis for our project. I am Cameron, and I will be joined by Jordan and John later in the project. First, for the overview of the disease, rheumatoid arthritis is a chronic disease that causes joint pain, stiffness, swelling, and decreased movement of joints. The most common type of autoimmune arthritis caused when immune system is not working properly. It mainly causes pain and swelling in the wrists and small joints in feet and hands. It sometimes affects organs such as eyes, skin, or lungs. People with rheumatoid arthritis are at an increased risk for osteoporosis, which is a condition that weakens your bones and makes them more prone to fracture and breaking. Rheumatoid nodules, which are firm bumps of tissue that are most commonly found around pressure points such as the elbows. However, they can also form anywhere in the body, including the lungs. They are also more prone to infections because the disease itself and many of the medications used to combat rheumatoid arthritis can impair the immune system, leading to increased reactions. They are also prone to carpal tunnel syndrome, which is, if it affects your wrists, the inflammation can compress the nerve that surrounds most of your hand and fingers, causing a increase in pain. This also leads to heart problems, which is caused by blockage of arteries as well as the inflammation of the sac that encloses your heart, and lung disease because it increases the risk of inflammation and scarring of the lung tissues, which can lead to shortness of breath. It can also lead to lymphoma, which is a group of blood cancers that develop in the lymph system. People who are female are at a bigger risk to get rheumatoid arthritis. Almost 75% more of the people who have rheumatoid arthritis are female. You're also at an increased risk if you are in the middle ages of your life, such as the late 30s to 40s. You are also more prone to rheumatoid arthritis if you have arthritis in your family history. Smoking and obesity are also big factors that add to the likelihood of getting rheumatoid arthritis. This can also be led to by environmental factors such as dust or asbestos inhalation. The specific cause of rheumatoid arthritis is the immune system attacking the synovium, the lining of the membrane around the joints of the body. In the United States, there are 1.7 million people with rheumatoid arthritis.
So next we're going to go ahead and move on to the diagnosis of rheumatoid arthritis. Rheumatoid arthritis can be difficult to diagnose in the early stages because the early signs and symptoms mimic other diseases. So for a doctor, if a patient comes in saying they're having wrist pain, it may not necessarily be rheumatoid arthritis. There could be something else wrong with them. There's also not one blood test or physical finding to confirm the diagnosis, so doctors have to take multiple findings to be able to come to the conclusion that their patient has rheumatoid arthritis. So during the physical examination, a doctor will check the joints for swelling, redness, and warmth, and they may also decide to check reflexes and muscle strengths. They're really paying a lot of attention to the joints because as you know, rheumatoid arthritis affects the joints and causes pain, stiffness, and decreased movement. There's also 2 tests to help confirm the diagnosis of rheumatoid arthritis, and that is blood tests and imaging tests. When looking at blood tests, there's 4 types of blood tests that can be done to help determine if a patient has rheumatoid arthritis. The first is looking at the erythrocyte sedimentation rate, also known as ESR, which is a type of blood test that measures how quickly erythrocytes, which are red blood cells, settle at the bottom of a test tube that contains a blood sample. Red blood cells normally settle relatively slow, and a faster than normal rate may indicate inflammation in the body. Another type of blood test is the C-reactive protein, also known as CRP, which is a blood test marker for inflammation in the body. CRP is produced in the liver And CRP is classified as an acute phase reactant, which means that the levels will rise in response to inflammation. You can also look for the rheumatoid factor. The rheumatoid factor is an antibody that can be detected in the blood of approximately 80% of adults with rheumatoid arthritis. And you can also look at the anti-cyclic citrullinated peptide, also called anti-CCP antibodies. And this is an antibody that is present in most rheumatoid arthritis patients. The other way that you can help diagnose rheumatoid arthritis is by imaging tests. So when looking at an x-ray, you can track the progression of rheumatoid arthritis. And you can also use an MRI and ultrasound to help judge the severity of the disease within the body. Next, we're going to be looking at the epidemiology. So when we look at epidemiology, the first thing we're going to look at is the prevalence. Prevalence is asking how many people are affected with rheumatoid arthritis. So in the United States, there's 1.7 million Americans currently living with rheumatoid arthritis. Of that 1.7 million, 75% are women. So there's 1,275,000 women living in the United States with rheumatoid arthritis. Next, looking at the incidences, this is looking at how many new cases are diagnosed a year. 41 out of every 100,000 people are diagnosed with rheumatoid arthritis annually. Next, we're going to look at the mortality rate. Because rheumatoid arthritis isn't fatal, there's no mortality rate. However, rheumatoid arthritis can shorten the life expectancy by 10 to 15 years. So even though it's not fatal, it can cause a big decrease in your life expectancy. Next, we're looking at the hospitalization, so how many people are hospitalized each year from this disease. There was a study shown that between the years 1993 and 2011 that there were 323,649 people hospitalized because of their rheumatoid arthritis, and this averaged out to be about 17,980 people a year being hospitalized within that time frame for their rheumatoid arthritis. There are also several risk factors that go along with rheumatoid arthritis. So the first one is sex. If you are a female, you're more likely to get rheumatoid arthritis than males. Next is age. Middle-aged people tend to be diagnosed with rheumatoid arthritis than any other age group. Next is family history. So if you have a family history of rheumatoid arthritis, it is likely that you will also be diagnosed with rheumatoid arthritis at some point in your life. Next, we have smoking. If you are a smoker, you are more likely to be diagnosed with rheumatoid arthritis. Same with being obese. Obesity is a risk factor as well. And then next, we have environmental exposure. Specifically, if you've been exposed to asbestos, that can affect you when it comes to being diagnosed with rheumatoid arthritis.
So now we're going to talk about burden of disease. This is direct and indirect costs associated with rheumatoid arthritis. First off, we're going to talk about pharmaceuticals. So that's biologic drugs, which we'll talk about in a little bit, over-the-counters, and steroids, basically. The biologics can cost $1,000 to $3,000 per month pre-insurance. Medical insurance tends to cover 70% of the cost on average. Your other option is surgery, and the average knee replacement in the United States costs $31,124. So as you can see, it's a pretty substantial cost in the long run. Some of the indirect costs, which are just lost economic production estimates, it's estimated to be between $1,500 and $22,000 per patient annually. So that's each person with rheumatoid arthritis. And an additional $10,000 can be added to that because of disability unemployment checks that they receive. That's a cost to the state taxpayer. One of the pharmaceutical treatments that's available are non-steroidal anti-inflammatory drugs. These are your typical over-the-counters, such as Advil, Aleve, Motrin. Stronger NSAIDs can be available with a prescription. Some of the side effects are stomach irritation, heart problems, and kidney damage. Another pharmaceutical treatment are steroids. So these are corticosteroids, which are used to reduce inflammation and pain and also slow joint damage. These are prescribed to relieve acute symptoms. Doctors will typically taper patients off of these just because you do build up a little bit of a dependency. Also, there are some side effects, so they don't want you on them too long. They're typically topical or orally dosed, but also have injectable options. Some side effects are thinning of bones, weight gain, and diabetes. Another pharmaceutical treatment are DMARDs, which are disease-modifying antirheumatic drugs. These slow the progression of rheumatoid arthritis and save joints and other tissues. Biologic agents, which are a subclass of the DMARDs, are what we were talking about earlier. They elicit a biological response in the cells. They're administered by injection or IV infusion, which is one of the reasons they're so expensive. We have a 2/3 success rate in treating rheumatoid arthritis with these biologic agents. 9 of them are typically available on the market. That's Humira, Enbrel, and Remicade are some of the more recognizable ones. Some side effects are increased risk of blood clots, liver damage, and increased risk of infections. The last treatment that we'll talk about is surgery. So surgery is used when joints are not responding to treatment or when joints are deteriorating rapidly. This is joint replacements and arthroscopic surgeries, which are meant to reduce pain and improve mobility. Some of these are synovectomies, which are surgeries to remove the inflamed lining of the joint. Tendon repairs, which are repairing tendons that were loosened or ruptured due to inflammation and joint damage. Joint fusions, which stabilize and realign a joint when joint replacement isn't a viable option, and total joint replacement, which is surgical removal of damaged portions of a joint and insertion of prosthetics made of metal and plastic.
Now onto the business perspective. As you can see in this graphic, by 2040, the CDC projects that 78 million adults in the United States will be diagnosed with some form of arthritis. This includes rheumatoid arthritis. Over recent years, it has been increasing and is projected to increase continually. In 2013, various types of arthritis cost $304 billion in the U.S. It will continue to increase over the years due to increasing medical costs and an increasing number of diagnoses. Phbu, the maker of Humira, a rheumatoid arthritis drug, have been adding additional patents to increase the time before generic drugs can be put on the market to replace it. The original patent for Humira expired in 2016, but they have been able to keep generics away by patenting manufacturing processes and other things involved in making Humira. Since then, they have made over 100 additional patents to protect their investment. Since 2015, only 5 biosimilar drugs are available for purchase in the US. So, after all of their patents that they have put out, Humira has been able to reduce the number of competitors they have in the market.